Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, board certified rheumatologist and obesity medicine specialist. Today, I'm sharing with you another learning experience, a case that actually you need to hear about. Again, I make these videos for information purposes only. If you are seeking medical help, please consult with your doctors. This video is not a treatment for you, but a case to learn about the medication to help you stay motivated about your health and make positive changes. And if you find this video useful, give it a thumbs up, like it, also share it with somebody who may find it useful. I would request you to subscribe to my channel so that more and more people can see it and I can share my passion of making people's life better through YouTube. Now, let's talk about this patient. So, this is a 38-year-old male who is experiencing a rebound of his weight. Uh, he initially started with us treatment back in November of 2022. At that time, the medication that we were using mostly as a first line treatment was Wegovy, the semaglutide. And as we were learning about these medications, we were following exactly what the company had FDA approval. We were starting the medication on the lowest dose, and every 4 weeks, we were increasing the dose. Over a span of 1 year, we started titrated up the dose rather quickly and to got him to a maximum dose. So every 4 weeks, I would increase the dose from 0.25 to then the next level, the next level, the next level until we reach the maximum dose. He had a modest weight loss, about 30 pounds in 1 year. I say modest because I've had patients who had less than 1 year, about 9 to 10 months, I've lost 70 pounds. But if you start on a very high BMI, your weight loss is going to be a lot more than when somebody who starts with a BMI relatively in the middle range. So his BMI was 34 when he started, but I have some patients who started with me with a BMI of 55 and they lose a lot more weight. It's just that you have more to shed off, and that's where your journey would be different than another patient. In any case, this gentleman, he is 6'1" and his weight was 250 when we started. And he started losing weight. Over the span of 1 year, he lost about 35 pounds, 30 to 35 pounds. And he was on a maximum dose of Wegovy, 2.4 milligram. His dose of Wegovy, for the last dose of Wegovy, we kept it for about 3 to 6 months. Yeah. And his weight, he achieved his weight goal and then he came off of the medication. Now, life happens. He was not going to the gym anymore. His appetite came back with vengeance and he had to um, he just couldn't control the weight gain. I consulted with him today and he said, I'm embarrassed to accept that I actually have gained back almost 85% of my weight. I said, well, I am not surprised because I've seen this again and again that if we are not able to maintain our weight loss through lifestyle and diet, we go back to old habits, we are going to regain weight. And another approach that I've learned with the experience is we have to slow down the increase in the weight medication dose has to be slower because it gives your body the chance to reset its new metabolic rate and adjust to the new weight. Your brain is not recognizing your new weight if you don't stay on that medicine long enough. So what I am going to do for this patient is I'm going to recheck his labs. Because I'll have to go through the prior authorization and getting the medication approved. But this time around, I'm going to get him approved for Zepbound, the newer agent. We didn't have that medicine at that time. I'm going to get that approved. I'm going to get him approved for after his labs of his high cholesterol, insulin, diabetes, hemoglobin A1C, cholesterol, hypertension. All this data is going to be there. We're going to apply for the prior authorization for Zepbound. But the tricky part is, or the strategy that I'm going to do is called slow and steady. I'm going to get him onto Zepbound 2.5 milligram, but I'm not going to increase it every 4 weeks. I'm going to go slow. I'm going to go every 3 months, increase 2.5. So when he loses first 8 to 10 pounds on 2.5, I'm going to try to keep pushing it for another month, another month, another month, until he no longer loses it. I have seen that people who are actually on a steady weight, they still continue to dissolve the internal visceral fat. Their waist continues to decrease even though if they're not losing weight. Plus, I don't want patients to be not able to regain the muscle. If I am going slow, I will also push them to make sure that they are going for strength training. Slower weight loss will allow them to gain the muscle they have lost initially and then we put back on it. Then we go to the next step. And that slow and steady rise in the medication dose will also adjust any GI side effects. Gastrointestinal side effects is one of the biggest reasons people are having issues. So I'm going to slow it down. This strategy, I think, would be better long term. We have very safe signals coming from the medication, not many side effects. Why rush the process? Why not give your body the chance that it needs to readjust to it? Plus, I have to give my patients the chance to adjust to new routine, new weight, new weight loss recipes, new food, and also making sure that they have a confidence of actually doing it on their own at a steady dose. And this strategy is going to be uh, promoted, I believe, in most weight loss centers, and I believe we will have a long-term effect. The positive part is, as you slowly adjust the medication, less side effects, more effectiveness, reversal of the metabolic diseases, and many other comorbid conditions will start reversing. We'll see decline in the cholesterol, with decline in hypertension. Today, I saw a patient who has erectile dysfunction got reversed, obstructive sleep apnea got reversed. So everything will readjust. Plus, I have to give time for my patients to shop for their new wardrobes. How about that? Okay, wonderful. So if you like these videos and you think they are helpful and I'm sharing my experience of patient day-to-day clinical cases, let me know by giving it a thumbs up and sharing it with someone, and also subscribe to my channel. Thank you for watching. I'll see you on the next video.